的各位评委老师，大家好。我叫ALMAAMARIAHMED，中文名字李勇，我的导师是苏文教师。今天是我的题目是福下面对癌霉素心脏对性影响机器分子机制。Today I will present my PhD project titled with the effect of fluvoxamine on Doxorubicin-induced Cardiotoxicity under the underlying mechanism. First, the contents includes 5 parts. Today, the first part was I want to talk about the red color drug, which is called Doxorubicin, and Doxorubicin is belong to the anthracycline class drug, and is effective broad spectrum anti-tumor used for the solid tumor like breast cancer and hematological tumor like lymphoma and leukemia cancer. The WHO, they mentioned that the Doxorubicin is essentially medicine used in the clinical. And his the mechanism by inhibition the DNA and RNA synthesis, which lead to the apoptosis. So, but now in clinical limited use. Why? Because his severe cardiotoxic reaction. So that means the Doxorubicin can attack the target and induce and create the anti-cancer effect. But in the other side, he can reduce cardiac toxicity like arrhythmia, heart failure, and finally the patient die. So that means today the patient with the cancer disease, tomorrow the patient with the cardiac disease. Also, Doxorubicin is irreversible and progressive cardiac toxicity. So, so the early detection and prevention, his cardiac toxicity is very important. The mechanism by which the Doxorubicin induced the cardiac toxicity till now unclear. And generally speaking, they said maybe due to the DNA damage, ROS, autophagy dysregulation, mitochondrial damage, and so on. So till now, no drug effective on Doxorubicin induced the cardiac toxicity. So today our drug is called Fluvoxamine. Fluvoxamine is new antidepressant drug, serotonin inhibitor with high affinity to the sigma-1 receptor. His pharmacological effect, antioxidant, anti-ER stress, improve the autophagy flux, and anti-apoptosis. For hypothesis, does the Fluvoxamine can inhibit the Doxorubicin induce the cardiac toxicity maybe through the contractile dysfunction, and inhibit the morphological change, or inhibit the ER stress, inhibit the apoptosis, and improvement the autophagy flux. The method, our animal experiment include 5 groups, and our method were ECG, HE staining, echo, serum biomarker, IHC staining, Western blot analysis. The results, now we need to know the Fluvoxamine play a role against the Dox-induced change in the ECG parameters. So our ECG results show that the QT, PR, QTC interval was increased in the Dox group, but the heart rate was decreased compared to the control group, while the co-treatment with the Fluvoxamine restored this change. And this result indicate that the Fluvoxamine attenuated the Dox-induced the ECG change parameters. So our HE staining show that the Dox can exert dysregulation of organization muscle fiber with hemorrhage, and also the echo results show that the Doxorubicin can cause cardiac dysfunction through the decreased ejection fraction, function shortening, and left ventricular posterior wall compared to the control group, while the co-treatment with the Fluvoxamine restored all of this change. And this results indicate that the Fluvoxamine attenuated Dox induced the cardiac morphological change and cardiac dysfunction. This result showed that the serum biomarker level like CK, CKMB, TG, NEFA was significantly increased in the Dox group compared to the control group, while the co-treatment with the Fluvoxamine restored this abnormal increasing. So this the result showed that the Fluvoxamine attenuated Dox induced the change in the serum biomarker. So as I mentioned before, the Fluvoxamine have high affinity to the sigma-1 protein receptor. So the IHC staining and Western blot result showed that the protein expression level of sigma-1 receptor was decreased in the Dox group compared to the control group, while the co-treatment with the fluvoxamine increase the expression level of the sigma-1 receptor, indicating that the fluvoxamine attenuated DOX-induced the sigma-1 reduction. Our molecular docking results show that the fluvoxamine have high affinity to bind with the sigma-1 receptor more than the doxorubicin, with free binding energy -7. Now we need to know the play role, does the fluvoxamine play a role and against the DOX-induced the AR stress? So the AR stress related protein in Western blot results show that all the AR stress protein increases in the DOX group compared with the control group, while the co-treatment with fluvoxamine decrease restore this abnormal increasing, and this result indicate that the fluvoxamine attenuated DOX-induced the AR stress. So the other results, we need to know if the fluvoxamine can inhibit the apoptosis. So the our Western blot results show that the apoptosis-related protein like Cas-3, Bax, Cavilon-1 were the increases in the DOX group compared to the control group, while the anti-apoptotic BCL2 protein expression level decrease in the DOX group compared to the control group, and the co-treatment with the fluvoxamine restored this the abnormal change. Thank you. Now we need to know the expression level of autophagy-related protein, and the Western blot results show that the LC3 protein level and BCL1 and BCL2, also the TFEB total were increasing in the DOX group compared to control group, while the LAMBA1, BOM121 and TFEB nuclear decrease in the DOX group compared to the control group, while the co-treatment with the fluvoxamine restored this change and indicated that the fluvoxamine attenuated DOX-induced the cardiac autophagy dysfunction. So finally, in conclusion, our fluvoxamine has positive effect on DOX-induced the cardiotoxicity by inhibit the AR stress and apoptosis, restoring the autophagy flux, and this effect may be mediated by the stimulation of the sigma-1 receptor. Any question?
谢谢，请评委同学们看看有什么问题。
So very good presentation.
Thank you so much.
It's very good topic, right? Doxorubicin-induced cardiotoxicity.
Yeah.
This is very popular in clinic, right?
Yes.
So why you choose this drug? Because anti-depression drug many, right?
Yes.
Why you choose this drug? Usually the anti-depression drug have a side effect in heart, in many organs, right?
Yes. First thing, we choose this drug because recently studies have studied this drug in the cardiac toxicity disease. This is the first answer. And the other, we use a small dose or safe dose, not like the dose uses in the antidepressant disease. We use 1 milligram and 0.5 milligram. That safe dose, and the results as shown here, it was really good. Not any side effect in our animal groups.
So can you pause the molecular mechanism of the fluvoxamine-mediated cardiac protection?
Yes.
So
yes.
There are several different effects of autophagy and apoptosis and the ER stress.
Yes.
What's the connection?
Yes. Now we know the sigma-1 receptor is the fluvoxamine is selective to stimulation the sigma-1, high affinity to stimulation the sigma-1 receptor. So the sigma-1 receptor where located? The sigma-1 receptor located in the place is called MAA. MAA, this place is linked between the space place linked between the ER and mitochondria. The sigma-1 receptor was in the membrane of the ER. It's bind with the IB3 receptor. So the IB3 receptor responsible to release the calcium from the ER to the mitochondria. Mitochondria receive this calcium by channel called VDAC. This channel. So if you have any like unfolded protein or ER stress, what's happened in the ER? We have three biomarkers ER stress. One is called PERK, as I mentioned before. Yeah, PRK, and one is one one alpha, and the other is ETF6. This biomarker is binding with the one protein called GRB78. If you have ER stress or unfolded protein, this GRB78 this link with these two biomarkers and go to bind with the unfolded protein for the proteasome and autophagy and other so on. So now these three biomarkers free when they free can stimulation the apoptosis proteins like CHOP, like XPP1, like PAX and cause apoptosis. This is the first part. And the second part, how they can cause this function. The autophagy dysfunction. The doxorubicin, as we know, previous study showed that the doxorubicin inhibit the fusion of the lysosome with the autophagosome. So inhibit the fusion, that means not autophagy flux happen. That means no clearance for the damaged organ. So accumulation of the autophagosome lead to the ROS. The ROS stimulation, the ROS cause cardiac toxicity. But our fluvoxamine stimulation the sigma 1 receptor protein lead to the enhance the fusion of the lysosome with the autophagosome and lead to the clearance, which means the autophagy flux enhancement.
I have one question for you.
Yes.
Have you done some experiment to evaluate the heart function using ways like ultrasound, not only the ECG?
Echo also. Echo. Yeah, I said. That's echo. Ejection fraction, function shortening, and left posterior wall also decrease in the dox group compared with the fluvoxamine. So compared with the control group. While the quadrant,
Sorry. How long time have the experiment?
for 2 weeks.
2 weeks.
Yes. Yeah.
I have to move on to the next one.
好，谢谢大家，我看一下这个新闻。